Okay, so today we talk about the cerebral cortex, chapter 13. There is two ways to divide this. One is called the neocortex, also called isocortex or a homogenic cortex. And from histology point of view, it has 6 layers, which I will show it to you in the next slide. And the other one is called allocortex or heterogenic cortex, and it has only 3 layers. So you don't find this in majority of the brain. You only find it in specific areas. So the 2 areas that you can find it, one is called archicortex, and that is in the hippocampus and dentate gyrus, and they are located in the temporal lobe of cerebrum. And the other one is called paleocortex, which is in the olfactory cortex, part of the limbic system. Hippocampus and dentate gyrus is also part of the limbic system. So the lobes of the cerebrum, we discussed this before and before the midterm, but the lobes, if you start from here, from the central gyrus, then this lobe is the frontal lobe, and as you can see, the gyrus in front of it is called the precentral gyrus, very important. This is the superior frontal gyrus, middle frontal gyrus, inferior frontal gyrus, and this is called orbitofrontal gyrus. It's part of the limbic system. Then is that parietal lobe. So this is posterior to the central sulcus. You see that this gyrus, this is called the postcentral gyrus, and again an important area of the brain. You also have the supramarginal gyrus, superior parietal lobe, and angular gyrus. Temporal lobe is separated from the parietal and frontal lobes by the lateral sulcus. This is the lateral sulcus. So you can see there is another gyri here: superior temporal gyrus, middle temporal gyrus, and inferior temporal gyrus. And this area is the occipital lobe, and it has the superior occipital lobe, middle occipital lobe, and inferior occipital lobe. If you look at it medially, this is the medial view. So again, central sulcus here. Anterior to that, you have the frontal lobe, and you have this gyrus is called the paracentral lobule, and this is the superior frontal gyrus, which is the same as this one. Posterior to the central sulcus, you have the precuneus, and you have the cuneus, which is part of the occipital lobe. And this is the parieto-occipital sulcus, not written there, parieto-occipital sulcus. This is cingulate gyrus, part of the limbic system or limbic lobe. There's other parts too, but it's not shown here properly. Here is the little bit cut here, and you can see other part of the limbic system or limbic lobe. This is a parahippocampal gyrus, and uncus is part of the parahippocampal gyrus here. You can see the lingual gyrus, part of the temporal lobe, fusiform gyrus, and the inferior temporal gyrus, which was this one. So this is the histology of the majority of the cortex of brain. So it has 6 different layers. The first layer is the molecular layer, so this is the most superficial layer. Then is the external granular layer, So lots of fibers are there. Then is the external pyramidal layer, so you can see neurons here, but they are smaller in size. Then is the internal granular layer, and this is the granule or satellite cell. Stellate cells are there, located here. Then is the internal pyramidal layer, and this is the really big pyramidal neurons are located. These are the largest neurons in the body, especially the motor ones are the largest in the body. And the deepest layer is called multiform layer, which has the cells have different shapes. So below the cortex you have different fibers, starting with association fibers. Association fibers are in the same cerebral hemisphere, and they do not cross in the same side. You can see superior longitudinal fasciculus, so it's connecting the frontal lobe with the parietal and occipital lobe. You can see uncinate fasciculus that is connecting frontal lobe and the temporal lobe, and the inferior fronto-occipital fasciculus that is connecting temporal lobe and occipital lobe, but also gets fibers from the frontal lobe. You can also see the arcuate fasciculus, and I will come back to this later. I will show you what is this importance of this. And the arcuate fiber, see, this is arcuate fasciculus, which is long, and arcuate fibers, which is shorter, and these are connecting the neighboring gyri. So two gyri connecting that are close to each other. It's connected by the arcuate fibers. Also, you can see the cingulum, and cingulum is part of the limbic system. So cingulate gyrus and parahippocampal gyrus and uncus is located as part of cingulum. If you make a coronal section like this, then you see a structure like that, and this darker area that you see, this is the cortex of the brain, and the cortex of the brain contains a cell body of the neurons, and these other areas are the white areas. So these are the fibers. So for the association fibers, they stay on the same side. So these ones that you see, superior longitudinal fasciculus, and this is the superior longitudinal fasciculus, including the arcuate fasciculus. You can also see the cingulum. This is the cingulum. You can see it's around here, and the third one is the inferior fronto-occipital fasciculus, which is this one. You also see some other stuff there, but it's not part of the association fiber. They are not part of association fiber. One is the corpus callosum that is connecting one side to the other side, and you can see the internal capsule. These are also the other fibers, but they are connecting cortex with the lower part of the brain. So these two are not part of association fibers. The second type is called commissural fibers. These commissures are connecting the two cerebral hemispheres. So the first one is a small one that's called anterior commissure, this one, and this is the one that connects the two temporal lobe. Then is the corpus callosum. This is really the big one. This is the corpus callosum that has different parts. So starting with the rostrum here, and then it goes to genio. Genio is located anteriorly. This is the bend. So genio means knee, and if you make a section around here, this is the area that you can see. This is the genium, and these are the shorter fibers. These are called forceps minor. Then is the body. So it's a bigger part there, and this is the body that you can see connecting the cortices of the two cerebral hemispheres on the two sides. And finally, splenium located posteriorly, and this is connecting occipital lobes. Body is connecting the frontal and parietal lobes, and geno is connecting frontal lobes on two sides. And the section here, you can see it in this area. So the forceps major, just fibers are there, longer fibers. You can see it here. And on this view, also anterior commissure, by the way, you can see the anterior commissure that was here, and you can see it. It's located lower than corpus callosum. And this is the posterior commissure. Posterior commissure is actually located in the midbrain, so we are not talking about midbrain here, but just for naming purposes I put it there. The third one is called the projection fiber. So projection fibers are connecting cortex of brain with other parts of brain. So let's start with this image. You can see this is a coronal section, and this is the cortex of the brain. These are the white fibers, that you can see. Let's talk about the projection fibers first. One of them is called corona radiata. Look at the name, corona. So this is one fiber, this around this area, and another one is called the internal capsule. This is the internal capsule on each side. So if you look at a little bit closer, then you can see something like this. So this is the internal capsule. So this has an anterior limb. Anterior limb is located between the caudate nucleus and the lentiform nucleus. It has a geno, and it has a posterior limb. So the posterior limb is located between the thalamus and the lentiform nucleus. The anterior limb, you can see the corticopontine fibers are there, so it goes from cortex to pontine. From there it goes to the cerebellum, and thalamocortical fibers are there, and this is coming from two different nuclei of the thalamus, dorsomedian and also anterior nucleus. Here in this area, the geno contains corticobulbar fibers. So this is the one that is providing upper motor neuron for the cranial nerves. And here is another corticopontine fibers in the geno. So in the posterior limb, you can see thalamocortical fibers, again from thalamus going to the cortex of brain, but it's coming from different areas, from VP and VL and VA, ventroposterior, ventrolateral, and ventroanterior groups of thalamic nuclei. Also the corticospinal tracts are located here, and you remember corticospinal tract from chapter 7, and that is the conscious tract that is important for movement of limbs and the torso. You can see that the arm is located here, trunk, and then limbs are located here. The fibers are located in different areas. So this is a more functional structure of the cortex of brain, if I say. So you can find again the central sulcus here, and anterior to that you have the primary motor cortex. So before it was a precentral gyrus, which is an anatomical name, and the primary motor cortex is a functional name. You have the premotor, so that's anterior to the primary motor, and you have the supplemental motor, which is superior and medial. The Broca area, which is for speech, located more inferiorly in the premotor cortex, and the prefrontal association area is a really big area and very important area for personality and other stuff, higher brain function, and I will come back to this later. On the parietal lobe, you can see the primary somatosensory area. So this was a post-central gyrus, and the somatosensory association area, or cortex, it doesn't matter, same name. In the temporal lobe, you can see the primary auditory area and auditory association area, and these are other association areas are there. Okay, and you can have the primary visual cortex and visual association area. The Wernicke area in this image is shown as here, but usually it's around this area. So it's located between the temporal lobe and occipital lobe and the parietal lobe. So it's a little bit this area, not totally on the temporal lobe. So the primary motor cortex, you can see it here. This is in the just anterior to the central sulcus. This is the conscious motor activity. This is the voluntary activity, and it is especially important for the distal muscles of the limb. So any activity that you want to do consciously, this is usually initiates from here. The premotor cortex is anterior to that, as I said before, and this is a little bit closer. So these muscles are in the limb muscles, proximal limb muscle, the ones that are attaching to the muscle, the shoulder and hip girdles, and axial muscle, which are the torso muscles. And then the premotor cortex has a map of different movements. So when you decide to do something, and the primary motor cortex is accessing this map and then executing something. In this image that you can see, this is called motor homunculus. You can see the cortex of the brain, but different part of the body has different sizes. For example, the pharynx, the face, the hands have a higher part and a larger part in the cortex than the other parts of the body. The main reason for that is that the fine-tuning of these muscles. So there's a lot of muscles are involved, and they are doing very specific movements, and this is why a bigger part of the cortex of the brain is responsible for those movements. For the rest of the body, for example, for the limb muscles or the trunk, it's just flexion, extension, and abduction, adduction. So it's not a lot of specific movements there. So this is why you don't need a lot of neurons there. But for these areas, you need more neurons because they are more specific. If there is a damage in this primary motor cortex and premotor cortex, then you can get a contralateral upper motor neuron lesion. Contralateral because if you remember it, this is part of the corticospinal tract, and it is crossing the midline, either in the medulla or in the spinal cord, and then it will cause motor problems. A specific lesion that I thought I should mention it here, if in the paracentral lobule. So paracentral, this is the precentral, right? So if you look at it more medially, I don't have an image here. If you look at it medially, in this area anterior to the central sulcus, this is the paracentral lobule, and that will cause the urinary incontinence. The supplemental motor cortex, which is located here, so it's anterior to precentral gyrus, and also again in the medial view you can see it, but I don't have an image to show it to you. So around this area, and this is again similar to the premotor cortex. It has a maps of the different muscle movements, and it has a sequence of the movements, so which movement has to first should be done first, and which one should be done second, or which movement should be done simultaneously. So this is a higher complex movements, and these movements are usually bilateral. It's important for vocalization, for facial expression, and for the movements of the limbs. So if there is any damage in this area, then you can get aphasia, with a problem with speech, and you can also get increase in the tone of the flexor muscles, but not paralysis. The reason there is no paralysis is because other fibers from primary motor cortex and the premotor motor cortex is also going down. So if there is a damage there, the other parts of the brain is helping. So you will not cause any paralysis, but it may increase flexion, tone of the flexor muscles. The primary sensory cortex is located here, just posterior to the central sulcus. And if you look at it closer, it can get a different, sensory stimuli. Some of them are coming from the muscle spindles, some of them are coming from the joints and the tendons, and some of them are coming from the skin. So different areas are responsible for that. The primary sensory cortex is responsible for conscious understanding of sensory stimuli. So if you are sleeping, the primary sensory cortex is not active, so you will not feel anything. For example, you are lying on the bed, even if the bed is hard, you are sleeping, you will not feel anything. But if you're awake, then the bed is hard, you will understand that it's there. So this is for the conscious sensory stimuli that is coming. It contributes to the corticospinal tract. Why? Because any sensory stimuli that comes, the brain processes that, and it decides whether to have a motor response to that or not. So if there is a motor response, then the signals are sent to the frontal lobe, which is the motor cortex, and then they will respond to that. So that's why it is part of the corticospinal tract. You can also have a sensory homunculus. The same thing that you have the motor, you have the sensory. So a different part of the cortex is responsible for different part of the body, and once again you can see the face, the hands, and the pharyngeal area, the tongues have a higher part for that, because there is a lot of sensory receptors are there in these areas. So special senses are there, and for example, the tongue is there, the taste, and other for the fingers, you want to do manipulation of different things, and you need to have a very high number of neurons to recognize any type of stimuli. Your face is very sensitive, but compared with that, your back, your abdomen, your legs are not that sensitive. Also, genitalia is here. It's hard to see it in this image, but genitalia is here. This is the cingulate gyrus, and genitalia is around here. So sensation of genitalia is there too. And if the primary sensory cortex is damaged, then you can get the contralateral loss of the tactile sensation, which is hypostasia. Hypostasia means decrease in sensation. Stereognosis is that you cannot recognize forms, and again it's a contralateral, so it is crossing the midline, if you remember it, from different pathways that are there. So you cannot recognize different sensations. And you also have the association area, so somatosensory association area, and this is to interpret the sensory stimuli that are coming. For example, you're touching your face and you know that this area touched your face, but if it is that sharp or dull, it is warm or cold, it's rough or smooth, depends what touched you. If that thing was touched before, you recognize that, and the information is stored there, and then you can recognize it. So somatic association area is helping the primary sensory area. So it has a lot of information about the previous sensory stimuli. So it gives a lot of information there. and distraction will cause a lot of other problems. So again, tactile discrimination is there, similar to the primary sensory cortex. Contralateral stereognosis there, similar to that. Statognosis is there, and that is the problem that the person is not able to recognize body position. So for example, somebody closes his eyes and they may not be able to know the legs are up or down. Idiomotor or classic apraxia is that the person has difficulty buttoning has shirt, for example, or combing his hair. Ideational or sensory apraxia is for they have a difficulty performing a sequence of actions. So like an activity that requires multiple steps, they cannot do it. For example, tying their shoes. Facial apraxia is that the person is not able to move their facial muscles, so they have a facial expression problems. And conduction aphasia is also there, and they have a difficulty with the speech and things like that. So then there is other visual cortices are there. So visual cortex is in this area. So this is the primary visual cortex, and this is responsible for vision, and then is the auditory cortex is there. So this is the auditory cortex. This is in the temporal lobe. So you have this is the primary auditory cortex, but you also have the auditory association area. So any sound that you hear that is processed in this area. You have the olfactory cortex, and that is in the medial part of the temporal lobe, but this is mainly part of the limbic system. It is getting information from the olfactory tract, olfactory bulb. And also there is another one is the gustatory area, and that is also in the inside of the lateral sulcus. If you open the lateral sulcus, this is the area that you can see. That's called insula, INSULA, and that's located there. By the way, this is another view of the olfactory cortex. So again, this is in the medial view of the temporal lobe, and this is the inferior view, but still that's in the medial part of the temporal lobe. Distraction depends on the where it's involved. So if there's a visual field is involved, you cannot see things properly. I will come back to this when we talk about vision. So chapter 15, visual hallucination is there, and also deafness. So if there is auditory cortex, it's a partial deafness. Why? Because both sides, both cortices are processing sound. So this is why you do not get full deafness, you get partial deafness. So then there is also other association areas in other parts of the cortex. So with the frontal, you get prefrontal cortex is there in this area, and then you have other motor association cortices around this area. The prefrontal cortex is really, really important because this is important for your personality, and it is preventing inappropriate social behavior. So if somebody is drinking a lot and then they are in the they are going to spring break, and that's why they do not understand their social responsibility, and that's why this is happening. You can see it in the news. It is important for paying attention to a specific task, and also for working memory. It is important for problem solving and making decisions. Initially, when you are young, it is concrete thinking, so everything is black and white. But as you get older, late teens, early 20s, then this part of the brain, changes, and that becomes abstract thinking. So you want to know the consequence of your actions, consequence of your decisions, and this is the part of the body that is important. How wise you are, so compared with how smart you are. Always wisdom is more important than being smart, because wise people always make better decisions. And I know you guys are wise, that's why you planned everything properly, and then you finished your undergrad, and you're taking this program, and after that you have plans to go to professional school. So this is all, or if you are going to research, same thing. So this is part of your plan, and that's part of the prefrontal cortex. You can see there's a lot of connections between the frontal lobe and also the parietal lobe, and that is both lobes are involved in attention. So they are getting back and forth, and that's part of the attention, that this why it's connected. So if there is any sensory stimuli that requires any kind of motor response, then the frontal lobe of course is involved, but the frontal lobe will communicate with the basal ganglia, which is deep around here, and also with the cerebellum. So that is they're communicating, and we talk about that later on. The frontal lobe is also involved in the limbic system. So the amygdala is usually important for the emotional response, especially negative emotional response. And look at the news, you can see that. Hypothalamus, that is part of the diencephalon, but also it's important for behavior, and also is part of the limbic system. And the nucleus accumbens is located in the ventral part of caudate nucleus, and that is also part of the limbic system. So this is why it is important for expression of emotion, because this is the function of limbic system, one of the function of limbic system. The frontal lobe is connected with different part of the brain, and this is why different neurotransmitters are involved. So dopamine is involved with the emotional response and the drive and everything, and you also have the norepinephrine or adrenaline, that's for attention, acetylcholine for motor activity, and serotonin is also for some emotional response. So there is a lot of neurotransmitters are involved in the frontal lobe. Damage to the frontal lobe, the person can get Phineas Engage syndrome. So not common, but these are the signs and symptoms. Inappropriate behavior, because that is frontal lobe is responsible for controlling inappropriate behavior, so suppressing that. Loss of adaptation and initiative, gait apraxia, so the person has a gait problem, because again gait is part of the motor system. Incontinence, part of the motor system. And abulia, loss of voluntary movement, so again part of the motor system. So a lot of motor abnormalities you can see. Parietal, in the parietal lobe you also have association area, and that is important for sensory stimulation. So any sensation that you received in the primary sensory cortex, then it's connected with the somatic association area, and that interprets that information, and that way you will understand the movement of people, the movement of objects around you. You will understand about yourself, around anything that surrounds you. Also it's important for attention and being focused on a specific task. And to be focused, you have to receive stimuli from different areas, so you can get information from any auditory system, so any sound information, speech, things like that. Visual information, so any visual stimuli are coming there, and also any motor activity, again is contact, it is in communication with the parietal lobe, so you can make a decision, so where to focus. And if there's too much adrenaline is released, now it's difficult for you to focus, so you cannot have a specific attention to a specific thing, and then you try to focus on many things, and you cannot do that, and that's why it will cause anxiety. So the parietal lobe is to remove a lot of less important stimuli, so the person can concentrate on a specific stimulus. Distraction cause contralateral asterognosis, contralateral neglect, which means that the person will not be aware of the other side of the body, especially it's on the right side, so the person of the right side that has a parietal lobe damage, they ignore on the left side of the body. And construction and addressing apraxia. In construction apraxia, the person is not able to build something. For example, you give them Lego, they cannot build it, or if you tell them to draw something, they cannot draw anything. And dressing apraxia, they cannot dress themselves, so they need help with those things. Temporal lobe has a lot of different functions. It is important for language, it is important for emotional memory, for factual memory, for sensory input, especially the auditory input, but also olfactory input is there. It's important, of course, for language, and it participates in the detection of objects that are moving, and also recognition of items and different objects. So it has a lot of different functions. And if it is damaged, you can get agnosia, which is inability to recognize objects or anything moving, and they also have problem with the language. Speaking of the language, so this is the more basic ways to talk about language, but there's also a more detailed one. So one area that is involved is the Wernicke area. So Wernicke area is in the temporal lobe and close to the occipital and the parietal lobe, and Wernicke area is receiving information from the primary visual cortex and visual association area, so for the things that you can see, for example when you read something, and also it should receive information, it's not shown here, it should receive information from the auditory area for things that you can listen. So Wernicke area is important for comprehension of written and spoken language. Then Wernicke area is connected with the Broca speech area, and this is for vocalization. So this is connected with the motor cortex vocalization area, and this is for movement of larynx. But Broca's speech area has a bigger function, so it's responsible for the amount of air that is coming from your lungs, so movement of the vocal cords, and a movement of the tongue, movement of the cheek and the jaw during speech. So all of them are coordinated by the Broca's speech area, and they are connected to each other by the arcuate fasciculus, which was part of the superior longitudinal fasciculus, which I talked about it before, that I will come back and talk about it. So this is the area, and if this is damaged, then the person is not able to repeat what they were saying, so they have this problem. In the Broca's motor aphasia, Broca is in the frontal lobe, so some motor, they have difficulty speaking, so they will understand things, but they have a difficulty saying things, and if they say something, it will be difficult for the other person to understand. they have also contralateral weakness of the lower face and arm, and they have sympathetic apraxia of the left hand. So they have different symptoms. Most of them are related to the movements and speech. In the Wernicke, it is sensory, so that is for the difficulty understanding word, difficulty finding word, and they may have difficulty understanding what they read. So this is more sensory, but they can talk properly. This is a more detailed part of the language. So we can start from here. So again, this is the central sulcus, this is the precentral gyrus, which is the important for voluntary movement, and that's for execution of speech. So you have to make a decision when you talk, and then this is the execution of speech. The middle frontal gyrus is responsible for retrieval of the word. The inferior frontal gyrus is responsible for syntax. And the temporal lobe, different parts has different functions. So the anterior part of the superior temporal gyrus is responsible for construction of some phrases. The middle temporal gyrus is responsible for comprehension of word, and the inferior temporal gyrus together with the inferior occipital gyrus is responsible for recognition of the people and objects. So people are more anteriorly and objects more posteriorly. The visual cortex, visual association area, this is for understanding and seeing anything that is there, visual stimuli. The posterior part of the temporal gyrus and the inferior part of the parietal cortex is responsible for the short-term auditory memory. So as you can see that the frontal lobe is involved, temporal lobe, parietal, occipital lobe, they are all involved in different aspects of the language. So it's very complicated. A different topic is called the mirror neuron system, and in this system a person actually look at the action and emotion of somebody else, and based on that they analyze the information. So different parts of the brain is involved, and there is a lot of different connection between different lobes of the brain, and including the limbic system is involved in this mirroring system. So when somebody does something, then you analyze that based on the visual stimuli, based on the auditory stimuli, and the general senses. So all this information is sent to the brain, and then the person will analyze the information, the complexity of the movements, and also other stimuli, and based on that they will make a judgment that if the activity is easy or hard, and they compare that with their own ability. For example, anybody can walk on a street, but maybe very few people can cross on a rope. Okay, so standing on a rope, I saw a video that somebody was crossing the Grand Canyon on a rope. So just imagine that. So I may be the only one that can compete with that guy, but that's a different issue. You understand how difficult that is, and you appreciate the movements. Also, this is important for motor learning. For example, you're trying to learn a dance movement or athletic activity or any arts and things like that. Somebody is trying to show you, and that way you can learn the movement. So it is important for overall development, and for emotional understandings of others, as I said before. So you appreciate how hard or how easy something else. So something that you cannot do it and somebody else can do it, then you can appreciate the difficulty level of that. The sex differences between the cerebral cortex. Okay, there's a lot of different research is going on here because there is different diseases that are common in men or women. For example, autism is more common in men, and also schizophrenia are more common in men, but Alzheimer's disease and depression, bipolar disorders are more common in women. So it means that maybe the brain of men and women function a little bit differently. Some stuff that is written in your textbooks, I just put it there, but there are other stuff that I don't want to include. One of them is that in the preoptic area of the hypothalamus, the shape in female and male, they are a little bit different, and male is a little bit larger, and also the shape is different. And the splenium of the corpus callosum of a female is bigger than a male. There is also differences in amygdala that is there, and the frontal cortex, a little bit differences there. There is a difference in the thickness of the cortex of brain. So although in your textbook it says that the ultimate outcome is the same, but I personally don't think so, and I don't want to make any specific comments on this, but I think everybody is a little bit different, and in men and women see things a little bit differently, not in a bad way, but they see it differently, and that's how the society needs both of them to have a make a better decision in major things. So that's my personal opinion, I think, and I think both sides, the way that they see things is a little bit different, but I don't know what you guys think, so we can talk about this when we have a discussion. Then is the blood supply. So you can the brain has two different blood supply. So this is the aortic arch, and then is the common carotid, and the common carotid branches into the external carotid, which is supplying the facial area, and then is internal carotid, which goes to the brain. Another one is that you have the subclavian artery, which is the branch of the aorta, and then it goes to the vertebral artery, and that goes through the cervical vertebrae, and that goes to the posterior part of the brain. So you have two systems. One is anterior circulation, another one is the posterior circulation. The veins are coming, the bladder, the CSF is drained in these sinuses, sagittal sinuses, and then they are coming and they are drained all the way to the jugular vein. So, and the jugular vein and then subclavian vein join together, and that makes the brachiocephalic vein, and then that drains to superior vena cava on each side. So starting from here, so these are the vertebral arteries, okay. It gives branches to the posterior inferior cerebellar artery. Also it gives branches to the anterior spinal artery. They fuse together, and that makes it the basilar artery. The basilar artery gives branches as anterior inferior cerebellar artery. Then also give another branches superior cerebellar artery, and then they become the posterior cerebral artery. Posterior cerebral. So these are cerebellar, this is cerebral. This is the internal carotid. So internal carotid comes and give branches to the middle cerebral artery and anterior cerebral artery. The two anterior cerebral arteries fused together, or they connected to each other, and that's called anterior communicating artery. And also the middle and posterior cerebral artery, they are connected to each other, and that's called the posterior communicating artery. Okay, so this is the medial view. So if you look at it, this area, so this is the anterior cerebral artery. So anterior cerebral artery is supplying the majority of the medial part of the brain, and the posterior cerebral artery, this is the lower part of the brain is involved here, lower part of the brain. And the middle cerebral artery, this is the lateral sulcus, and it is supplying the lateral part of the brain, lateral part of the brain. If you make a coronal section, so some structures that you can see here, this is the caudate nucleus, this is the internal capsule, this is the lentiform nuclei, so these two are the lentiform nuclei, and here is the internal carotid. Internal carotid comes and branches. One is the anterior cerebral, which is going more medially, and the lateral cerebral, which is going more laterally. The middle cerebral that going laterally. So the middle cerebral give branches as lenticulostriate artery, and this lenticulostriate artery you can see is supplying these areas, so caudate nucleus and globus pallidus, putamen, and then it branches again as the inferior and superior divisions, so supplying the lateral part of the brain. And in this image, there is you can see again the anterior cerebral is located medially, the middle cerebral, which is more lateral, and the posterior cerebral, which is the lower part of the brain. And there is another one here, this anterior choroidal artery, which you can see that this is part of the internal capsule is here, this global pallidus is here, and also this is amygdala is around this area. Okay, so this is the transverse section of the brain, and you can see this, the anterior cerebral artery is more medial, it's a little bit anterior but it's more medial. The middle cerebral artery, which is the lateral, and the posterior cerebral artery, which is also medial but also inferior. Same idea here, you can see the posterior cerebral artery supplying the inferior part of the brain, anterior cerebral is supplying the middle side, and the middle cerebral is supplying the outer side. There's some other areas, these are called watersheds, so there is a couple of them here. One is between anterior cerebral artery and middle cerebral artery, and there's another one, another watershed is here between middle cerebral artery and posterior cerebral artery. These are the areas that these arteries are connected with each other. The bad thing about that is that this is at increased risk of stroke in these areas. So these areas are suffering higher strokes because of that. And that is it. So if you guys have any question, we can talk about it later.